So psoriatic arthritis is an arthritis seen in individuals who have psoriasis. And we find that about 30% of individuals with psoriasis may have psoriatic arthritis to varying degrees. When you talk to a rheumatologist, or when you see patients from a rheumatologist, frequently there's a lot of arthritis but very little psoriasis. So it may be that there's a subgroup of people, little skin involvement, but their joints are very affected. Typically, the patient will complain of pain in a joint and stiffness in the morning that may last for half an hour or an hour, and as the day goes on, the symptoms improve. And there are a number of different subtypes of this arthritis. You can either define them as arthritis occurring along the spine, or arthritis that occurs on the fingers, the distal joints, or perhaps sometimes in a single joint, and there's often inflammation where tendons attached to bones. The difference in arthritis and the psoriasis in the skin is the skin can recover. You have a patch of psoriasis, you treat it, and the skin goes back to normal for all intents and purposes. But a joint that's been inflamed, potentially scars, and you have destruction of collagen, that's lifelong. So it's very important for us as dermatologists to recognize the early signs of arthritis, because we now know there are these biologics are probably much better than the older drugs in trying to prevent the destruction of joints. It's thought to occur in about 30% of individuals with certainly severe psoriasis, and then we see it often at the other end of people who don't have much psoriasis and they have lots of arthritis but small patches of psoriasis. Okay. So anybody with psoriasis who has a single joint that becomes swollen and painful and stiff, and this does not respond to an Advil or one of these over-the-counter anti-inflammatories, I think they should see a physician. And I think that individuals with psoriasis who have complaints of stiffness and pain in the lower back and loss of mobility because of arthritis in the lower back, they too need to see a rheumatologist. I'm impressed by how often we see patients who are treated for their psoriasis using, say, a biologic, and after they get better they say, I never realized how sore and stiff and uncomfortable I was before that. So we do adapt to the circumstances and often ignore these things. So my message is, be careful not to ignore the signs of pain, swelling and stiffness in joints in people who have psoriasis. The first thing to say is that as a dermatologist, I rely on our rheumatological colleagues to treat this, and I think it depends on the severity and the responsiveness to the drugs. And non-steroidal anti-inflammatories used. If they fail, there are drugs called DMARDs. There's hydroxychloroquine, there's methotrexate, and then in cases of failure, they go on to the biologics. And in some circumstances, when the problem is acute, they may even start with these newer, the TNF inhibitors are frontline drugs for psoriatic arthritis.